Hi, my name is Sattva Neelapu. I am professor in the Department of Lymphoma and Myeloma at MD Anderson Cancer Center in Houston, Texas. At this year's ASH, we are presenting the interim analysis of ZUMA-12, a phase 2 study of axicabtagene ciloleucel or axicel as part of first-line therapy in patients with high-risk large B-cell lymphoma. To be eligible for the study, the patients had to meet at least two high-risk criteria. So first, they have to have high-grade B-cell lymphoma with either double hit or triple hit lymphoma, or large B-cell lymphoma with an IPI score of 3 or higher. In addition, they have to have a positive interim PET scan with a dual score of 4 or 5 after 2 cycles of standard immunochemotherapy such as R-CHOP or R-EPOCH chemotherapy. Once the patients have been enrolled in leukapheresis, they received conditioning chemotherapy with cyclophosphamide and fludarabine for 3 days, followed by a single infusion of axicel at a dose of 2 million CAR-positive cells per kilogram body weight. The primary endpoint for the study was complete response rate. As of the data cutoff of August 25th, 2020, we enrolled and treated 32 patients with axicel, and the median follow-up was about 9.5 months. We observed a total overall response rate of 85% and a complete response rate of 74%, and 70% of the responses were ongoing after a median follow-up of 9.3 months. The therapy was quite well tolerated. Most patients did have grade 1 or grade 2 CRS. 9% of the patients had grade 3 or higher CRS, and about 69% of the patients had grade 3 or had neurological toxicity, with 25% having grade 3 or higher neurological toxicity. But all CRS and neurological events were reversible, with the exception of grade 1 tremor and grade 1 memory impairment ongoing in 2 patients. So to summarize, ZUMA-12 is the first study to evaluate CAR T-cell therapy as part of first-line therapy in patients with high-risk large B-cell lymphoma that were defined by both histology or IPI, as well as a dynamic risk assessment with PET scan. This study and this interim analysis shows that axicel can be safely administered and demonstrates substantial benefit with a high overall response rate of 85% and 74% complete response rate, and 70% of the responses are ongoing at a median follow-up of 9.3 months. The study enrollment and follow-up is ongoing, and the final analysis of the results with longer follow-up are expected to be presented sometime next year.